Morning, everybody, and just want to thank the Albany County Legislature, the partnership we'll be announcing today, which we have announced, but we'll be announcing other things, and Chairman Andrew Joyce for being here, and our County Legislator Wanda Willingham for being here, our Community Fund, and I think that's everyone. I'm pretty sure, right? Hopefully I didn't forget anyone. Today marks 329 days since this started. We're going to hit the 11-month mark, believe it or not. And I was talking to my deputy, Dan Lynch, last night. We were going back and forth, and we figured out our last day off in the office was February 19th of last year, when everything started going forward from there. So it's been a long year. I know it's been tough on everyone, but we need to continue to be vigilant. We need to continue what's right. But sadly, 2 more Albany County residents passed away last night. 2 are the 2 women in their 80s. My condolences and prayers go out to the family and to the 324 people that have lost family to this COVID-19. Again, it's a hard time to lose anyone for any reason, let alone through COVID, let alone in this new world we're in, when you can't say goodbye in the right way. The way we used to like to celebrate someone's life and their legacy and the impact they've had on not just their family but their community, and not being able to be with your loved one, unfortunately, if they're in the ICU or at the hospital and you can't be by their side when they take their last breath. So again, please, everyone, just remember, do the right thing. We'll get through it. We're here. It's a marathon, not a sprint. We're almost out of this. We just need to get vaccine in arms to get moving forward. So as of today, there's 18,716 cases of COVID-19 to date in our county. We have an increase of 155 positive cases since yesterday. Our 5-day average now is 112.8. Yesterday, it was 119. We have looked, I actually was talking to General Murphy earlier, and actually, General, here's a question I'm going to have for you because I've got sidetracked with a bunch of other stuff. Was how many state sites were shut down and why are testing. We, Dr. Whalen and I said it both. We were going to hit the peak and come down, but we were dropping real low. Was it because testing wasn't available? And actually, less people who have been getting tested, and we'll show that slide at another time. But if you go on to the state website or ours, it shows the graph of how many, I think it was like 4,000 a day compared to dropping down to like 2,000. So don't hold me to the number. So everyone out there, you can check for yourself. I'm just going off of memory here, but it's in that neighborhood. So we need to continue to monitor that and address it as we move forward. There are currently 2,511 people under mandatory quarantine. 2,400 of them have had COVID-19. We now have 49 close contact to positive cases. So 49 people out of the 155 are close contact, 13 are healthcare workers, 2 reported traveling out of state, 91 don't have a clear source of infection. As of today, 56,341 people have now completed quarantine. Of those, 17,496 tested positive for the virus and have recovered. That's an increase of 174 recoveries. So yes, people on Facebook, pay attention. We put out the numbers of people that had it and that recovered, and we also put out the people that were infected and continued on with everything. So, but unfortunately, it's our hospitalizations that still continue to haunt us here in the Capital District, especially here in Albany County. There's 12 new hospitalizations overnight. Currently, there's 126 people hospitalized with the virus at this time, which is better than the all-time high we had of 189, I believe, at that point in time, somewhere in that neighborhood. Yesterday, we had 16 patients currently in the ICU. Today is the same. And as I say this, please continue to wear a mask, cough into your arm, socially distance, and do the right thing, and we'll get through this. For those who want to get the vaccine or check their eligibility, please continue to use the state's website and their hotline at 1-833-697-4829. You can also call United Way 211 for getting information, and we'll get through it. The good news is today, actually before we even get to that, vaccine, one of the questions we keep getting asked about is the new group that the Department of Health, I believe, or the governor opened up to restaurant workers and to food delivery people at the discretion of that county. It's been a question we've been asked for. We will not be opening that up here into the county. We still have people in 1B category, in 1A that have not got the shots. We still have a lot of seniors over 75 and 65 that have gotten shot. And I got to say, one of the moving things, and I've been talking, made it personal about myself. about my sister-in-law having ALS and how she can't get a shot, I can't get her a shot. But you look at Chris Churchill's story today in the TU, and it says it all. It says it all. For some reason, we're dropping the ball on these residents that need to get the shot, and we're not addressing that issue. So I am requesting through the Department of Health to look at the matrix of how they're handling this. And Chris is right. It's a hard decision when you have to decide who gets the shot, who doesn't get the shot, who fits in the category. It's hard. But this disease has crippled more people with underlying health issues, because that's what everyone likes to hear when I say someone passes away, that they had underlying health issues. Well, where they have, they don't want to hear it was a healthy person. They want to hear it was someone with underlying health issues. And I know mentally that helps us get through it and say, okay, I know, but we need to address that. I've been saying this for months now, and that was the partnership why we did with Mohawk Ambulance today, and I'll get in that in a minute. But when you look at essential workers, how do you define it? And, I get this every day. I have essential workers that have come in this building for the last 11 months. They didn't get to stay home for 4 months. They didn't do the right thing. They had to come every day. But yet, they don't fall in that category. I don't fall in that category. It's the way the guidance is, to bottom of 1C with my deputy, my counsel to me, the people that keep the county running. And, I was just listening. Aging department, public defenders, alternate public defenders don't qualify. But other people in the court system did. I can't figure that one out, and they're there every day. Board of Elections, they have a mission. We just went through one hell of an election, right? And we will continue to move forward. But they don't qualify, and think about people that are going in and out of the Board of Elections, and we just had an outbreak there. And we just had a little cluster in the BOE. So again, are they not essential? Depends on your definition of essential, and that's what we need to define and work together, not finger point. I don't want to say someone delivering food is more essential than me or the chair of the legislature, but we got to do what's right to continue to move government forward and get the shots in the thing. You look at the county clerk's office. Bruce Hilley's been doing a great job, but they don't fall under it. HR, finance, mental health. Our mental health doesn't. Public Works, DPW, DGS, DSS. Think about this. They have seen more services go through their doors these last 11 months than they've had seen in years. People who've been laid off because of the unemployment, who need SNAP, who need heating assistance, who need food, who need housing. And they have to see them face to face, because it wasn't set up where you could do this online. We've got some of it online, but people still have to come into that building, and they still have to help them. But they're not essential. I can't get the vaccine to them. Our water purification district, they handle our plants where we flush your toilet. They're not essential. I mean, it's just, we have to define this better to move forward. I think Chris's story says it the best, and my phone was blowing up. Everyone was joking, hey, I just filled out a Lyft application. So I qualify. Yeah, if I opened it up, you would. And I think, and hear me, our restaurant workers have been the backbone of our community. They've kept these restaurants open. Some restaurant workers, if you take the opportunity to meet the wait staff, the waiters, the kitchen help, the chefs, they're the best people in Albany County. I got to be honest with you. They care. They come together as a community. They take care of one another. I want to see them to get it, but I want to see the people that are most vulnerable right now with underlying health issues who this has been affecting get the shot first. So please be patient with us, and that's why I said just be patient, wait your turn. Like I said, I'd love to get my shot. Andrew and I can get it in the military right now if we wanted to. I can go to the VA hospital and get it right now if I want to as a combat vet. But you have to lead by example, and you got to make sure that people get it that need it first. Underlying communities, the black and brown community has been affected the most by this. But we also have to operate and continue to go forward. So again, we'll get through it, working together, not finger pointing, but we really need to solve this issue. And one of the things was we saw months ago, and I worked it out with Mohawk Ambulance, a great partnership. And Mohawk Ambulance today, we launched today at our first site of many in the city of Albany that are going to go through housing, is to get shots into the most vulnerable people we have here in the county, and we're also doing it in Cohoes and Waterville. I do want to say to Javon from Mohawk Ambulance, Thank you to Mohawk Ambulance. This has been going on months. We had to get them certified on the federal level. Then the state took a while, and then we had to get buy-in from the Department of Health. And thank you to the Governor Cuomo for making this possible. They got the vaccines. They were there today. It was successful. People are getting the shots in their arms that need it in these communities, and will continue to roll out and only get bigger. We're hoping for 4,000. We got, I think, roughly 800 today, and hopefully it will grow more as Mohawk continues to be successful through Albany County and through the housing, and to Chiquita from Albany Housing. Thank you so much today for the partnership. Thank you for everything that she's done in Albany Housing. And to Mayor Sheen, great partner, and she jumped right on it when I talked to her and I needed help with the Mohawk Ambulance. Got it quickly. We worked together, and we made the first announcement January 10th. And I want to thank Andrew Joyce and the legislature for partnering, because I do bounce it off of him. We go back and forth. So, Chairman, thank you for that. And again, I do want to say thank you to the governor, because it's part of his point of getting into these vulnerable residents, but we have to make sure we address it to everyone. And I will be happy that one day I can sit here and say I got my sister-in-law shot in her arm that can't get out of the house, can't move, talks through a machine, and's been living with this for about a decade now. And hopefully that will happen, but not yet, not as of today. So the other reason why we're here, I do want to say one thing. Rite Aid, our Department of Aging partnered with Rite Aid. They wanted help getting vaccines out to seniors. We jumped in. Same thing, we're doing a partnership with the VA hospital for vets. That's what I was talking to Andrew the other week about. We're going to be helping them with veterans that are home that they have vaccine to get out. But Rite Aid vaccinated a lot of seniors at Beth Emeth last week. So thank you to Deborah Tano from Department of Aging and Rite Aid for partnering with us. This was, through Rite Aid on the federal side of it, not on the state. It was a huge success, and a lot of people got the vaccine. And again, I want to use what Colonel Gibson said. You know what? Everyone wants a shot, but every time we get a shot in someone's arm, it's closer to us getting opened. So you got to look at it that way. And I looked at Chris and I go, that was well said. You're absolutely right. If I know everyone who wants a shot, but just think of it this way. The more shots that people are getting in their arms, the quicker we get close to getting rid of these and stopping the spread of this infection. So, again, one of the things we saw in Albany County, we did have a strong sales tax numbers in December with an increase of 7.7 overall. December 2019 year overall, the local sales tax revenue dropped 6.8 from 2019. So we did see roughly about 19.8 million lost in revenue. So that means businesses are suffering, and that means a lot of businesses that don't understand it. And one of the things that we talked about and we had the issues was with the PPE loan. I brought this early on. I think it was either the Troy Record Gazette, or it might have been a T. One of them, or the Altamont Enterprise. I don't know which one it was. Wrote a great story on all the people that got the PPE loans, and they were huge companies, and they were law firms, and it didn't affect the smaller businesses. And when they don't have the resources or the tools to put these applications together, go into a bank and have that relationship. I had Tom Nardashian talking about that, how they don't have that relationship. He can walk into a bank, he knows the person, and he gets the PPE loan. So I do want to say to the Albany County Legislature, Chairman Joyce's leadership, and to all the legislators, Wanda Willingham and everyone else that was involved with this, they came back through the budget process for $500,000 for small businesses that would go to small businesses and help them get through these difficult times. So we also, with the Albany County Alliance Local Development Corporation partners, the Dayton Community Loan Fund Partnership, thank you so much. And to break it down a little bit, and I'll turn it over to Andrew in a second, grants are up to $500,000. I believe there was 268 applicants. 170 of them were deemed eligible, and from the pool, 132 grants are being forwarded. And more than half of those awards are going to minority-owned businesses, minority women-owned businesses, women-owned businesses, and veteran-owned businesses. So I'll let Chairman Andrew Joyce talk about it. Chairman.
Thank you, County Executive. And again, as we do when we come here to talk about issues during your briefings, I want to thank you and your administration for all the work that you've done since February last year in the fight against COVID. And it's a bit of a gut check for us in legislature, because we're constantly trying to figure out what we can do to rise to the occasion and help people in this county see their way through the pandemic. And we're going to go over a lot of numbers and figures and kind of the history of this grant program as we talk about it through the program today. But I want people to consider what the city of Albany would be like without a Jack's Oyster House. What would the city of Albany, what would our downtown be like without a McGeary's? What would Waterville be like without a Purple Pub? As the county executive had mentioned before, these institutions, these restaurants, these businesses, and the people that run them and the people that work there, they're part of the backbone of our community. They keep our community going. They're our friends, they're our neighbors. And these are the individuals that stepped up incredibly at the beginning of this pandemic and have been doing a lot of great work through. So I'm not saying that they were going to close down or they're in danger of closing down, but I just want us to put that into perspective, what our community would be like without these institutions. And that's a reality we were facing if we didn't step up and do something. So at the height of the pandemic, we convened in the Albany County Legislature our COVID-19 Economic Recovery Task Force that consisted of our Deputy Chairwoman, Wanda Willingham, Albany County Legislator Matt Peter, and Albany County Legislator Jeff Purley. And we got to work immediately to figure out ways we can help people throughout the pandemic, what we can do in a business sense to come up with ideas and innovate and be creative and to get people through the pandemic. So one of the first ideas that we came up with was a small business grant program. And one thing I learned from the county executive through my first couple of years in the county legislature is how much of a fiscal conservative he is. He won't tell you that. But I learned a lot from the county executive in terms of the budget, crafting and the budget making. And this is a big idea, it was a bold idea, and he was on board with us right from the get-go. And we were very fortunate to have Kevin O'Connor as well as a partner, moving into this idea with our local development corporation, and now our Advanced Albany County Alliance, our economic development arm. We're able to talk about these grants that we're going to be issuing tomorrow, 132 total. And as the county executive mentioned, they span all across Albany County, very diverse set of businesses that are going to need our help. And it was a great partnership, and this is local government at its best. It's the county legislature, the county executive, his administration, our economic development experts, and now the Community Loan Fund, Linda from the Community Loan Fund, who jumped right in with us from the get-go to help us do this in a defensible, fair, and equitable way when we committed these funds to this program. So I want to thank Wanda, Matt, and Jeff, and Eric Ford in our office, and Mike Morris in our office for everything they did behind the scenes to get us to this point. These grants will be announced tomorrow. Like we had mentioned before, spanning Albany County, over 130, a diverse set of businesses. It's an incredible effort, and there's more work to be done. Wanda's looking very comfortable over there, but what we're going to do is ask her to get back to work after these grants get issued, because we did commit some more economic development resources going into 2021. So we are mindful of those who may not have made it this round. We're working to continue to be innovative. We're working to continue to be creative and talk about ways we can help these businesses. So again, I want to thank the county executive for his partnership. I want to thank his administration and his team. I want to thank Linda from the Community Loan Fund, Kevin O'Connor from the Advanced Albany County Alliance, and Wanda, Matt, and Jeff, and Eric, and Mike for their incredible work. And also our majority leader, Dennis Feeney from Guilderland. He got on board with this idea right from the get-go, and even came up with ideas for us to commit more funding to this. And one thing that I can say through this experience and through this crisis is that we're thinking big, and we're thinking bold, and we're thinking creatively. And this may not have been something we could have done without this crisis before us. I mean, it's kind of hard to step into this kind of idea. It's $500,000, and it's a big idea, but everyone got on board with it very quickly. Very proud, and this is local government at its best, and we're looking forward to providing relief where we can. And I think we're going to turn it over to Linda now to talk a bit more about specifics and next steps.
Thank you. Thank you, Chairman and County Executive. This is the best for Albany County. $500,000 going out in grant funds to small businesses who really need the money. They really need help getting through this COVID pandemic and need that little bit of assistance just to help their businesses be successful. So the Community Loan Fund is thrilled to be partnering in this program. I wanted to speak a little bit about the process. We accepted applications. We had 268 applications come in. We first reviewed all applications for eligibility. Businesses had to be located within Albany County. They had to have 50 or fewer employees. They had to generate sales tax, and then they had to demonstrate that they had lost revenue during COVID of at least 25%. The businesses that met all of those requirements, there were 172 of them, were then evaluated based on need. We took a look at what other funding sources had these businesses received. There was EIDL, there were the CARES Act funding, there were other types of grant programs that were out there. Who received money and who did not? Not surprisingly to us, and it has been reported in the news, that minority and women-owned businesses received much less federal funding than non-minority male-owned businesses. So when we looked through need within Albany County, there was a very high need for our minority and minority women-owned businesses. So we were able to grant them more awards because the need was so high. What we're going to be doing going forward is we're going to be making an announcement tomorrow. There's going to be a list on the website of the award recipients. We're going to be emailing all of the award recipients and asking for their wiring instructions. We'll be wiring the funds to them. The other thing I'm very proud that we're able to do is provide technical assistance to the award recipients and actually to all the applicants. We've developed a series of workshops based on challenges COVID has been presenting all of us with, and we are offering all of those free of charge to small businesses. So we're certainly thrilled to be able to do that. Thank you.
Linda, thank you. Thank you to your whole organization, the Community Loan Fund of the Capital Region, because you did a lot of work to make sure to go through. Kevin, to you and the Alliance, thank you for what you're doing, because it takes a partnership, and that's what I was saying earlier with Mohawk Ambulance and everything else. It's not about one person. It's about everyone coming together. Chairman Joyce just said it. It's about everyone working together, getting on the same sheet of music. Doesn't matter if it was his idea or Wanda's or Kevin's or Linda's, whose idea it was. It's about coming together and working for the people, because they need leadership. And Andrew and I have talked about this 1,000 times in the last 11 months, that being combat veterans and going through mobilizations, you see the good and bad in people. And you know when you have to come together and lead, and there is time for finger pointing a year from now when someone goes to write a book, or the scholars get together and write about the good, the bad, and the ugly, or how we handled something, didn't handle something. And I've said this before and I'll say it again, I have to sleep at night. We have to put our heads on the pillows, and the decisions we make, hopefully every time, are the right ones. Probably that's why I don't sleep less than 4 hours a night, but it's tough. It's tough, and it's easy to finger point. And there's a lot of things I can agree to disagree with the governor of the state of New York, but I can't imagine the pressure he's under compared to what I've been under in just in a little county of over 300,000 residents versus over 19 million New Yorkers, in dealing what he's dealing with. And I say to people, it's easy to get online and to criticize somebody, to say something negative. Try something positive. And try to be positive about it. And if you have a better answer to the solution, put it out there and work with us. And I hope, I can say this, I hope down in my heart I do every decision I make is the right decision, but I can assure you it has not been. I can assure you there's stumblings we took, but based on the guidance or based on the science or based on that information at that time, that's what we did. We're dealing with something we've never dealt with before in our lifetime. And hopefully we never deal with it again. I can't answer all the email questions and questions that we get at the county level. Why could people not get married last year and not this year? One of which, I do love my daughter, is her. She couldn't get married last year, and then she finally got married in October with less than 40 people. And now weddings go open up. Listen, times are different, and all I can say is this, is take the memories that you're making and turn it around. And just remember 5 years from now when you sit back and you look at this piece of our history, that you got through it, and you'll probably laugh about it and do things backwards. And as I said to my daughter, okay, get married, then do the shower, then do this, and continue to do things backwards, and just make the best out of it. And that's all we can do is make the best out of this. And one of the things is other things go on in government. We still work. I can't tell you how many conversations we had and stuff we're going to be announcing in the next week or two, because we have to continue to move forward. So I know as much as this has been going on, there's other things. But February is American Heart Month. Tomorrow's National Wear Your Red Tie. which I got that wrong, but I got a Zoom call, so thanks, Mary. The red tie was for tomorrow. Unfortunately, I have enough red ties. But National Wear Your Red Tie tomorrow, please, is tomorrow. Call attention to the number one health threat for women, and that's heart disease. And, please, losing one woman to heart disease is too many. Hopefully it's never affected anyone in your life. It has affected people that I know, near and dear to me, and we have to continue to get through this. There'll be a Zoom press conference later today to encourage the better way for a healthy heart through diet, exercise, reducing stress, making sure that women in your life live and get through this, and about awareness and education and self-exams and everything else to the caregivers. Thank you. I was laughing with Mary when we were going over the exercise part, because I feel sorry for the media people out there that have to do this on the camera all the time, because I had 3 ladies go to me, they go, man, you're not as big in person. I go, what's that mean? Well, you're not as fat in person. And I go, thank you. I appreciate that. I go, the camera, so I want to put it out there. The camera adds 20 pounds, people, all right? And if there's multiple cameras, it's 20 pounds per camera, all right? It's not 8 chins here, as they like to say in certain radio stations. It's only 2, so... please.
They got a face for radio.
Yes, yeah, I do have. You're right, Chairman. I got a face for radio
Not
where you
you, not
can't
you.
see me. So I do want to say, please, find the humor in the situation and make the best out of it. And that's what I took from that story. And she was like, "No, I didn't mean it that way." I go, "No, it's okay." I go, "You're not the first one to tell me." Again. You can take a negative, or if it was a negative, not a negative, and it was turn it into a positive situation, and we'll get through it. We'll get through this together. Please, as always, Whitney Young, you know the drill. I don't have to say it again. Whitney Young, you know to call them, 518-465-4771. University of Albany, as always, great partnership with all of them out there. Thank you for what you're doing. You can schedule an appointment, 188-364-3065, albanycounty.com. Our mental health, please call it. They're taking calls. If you have a child, they'll listen to your child. We'll get you the right person to deal with your children's situation. We need to work at it. And I don't know the particulars of the girl that got pepper sprayed, the 9-year-old. I just saw it and it broke my heart. And when I see something like that, that's, if the child or someone's having a mental health breakdown, let's be there for each other. And these are the numbers that you can call. Call this number. Let us help you. And again, I don't know the whole particular, so I'm not trying to get into that, but I'm just saying it breaks my heart, because kids are having a hard time, and if that doesn't open up your eyes, I don't know what will. So please, our 24-hour sexual assault hotline number is always 518-447-7716, and the times that they have. And as always, the 211 in New York State hotline. Again, thank you for everyone doing what they need to do. We're almost there. We got the demand. We just need the supply of vaccines, but it's picking up. And hopefully by the summer, everyone will have it, sooner than I thought in September and October.